learn science, but we learn humanity.
This is really a joint effort. We all know that this is now considered as a public health emergency of international concern.
Every time something happens, we seem to be caught out by surprise, but increasingly now I think we just have to accept that this is the state of the world that we live in.
There are many important questions that will influence public health recommendation. And so for us, this science, rapid science, is so important.
There's a large group of institutions and organizations that wanted to be part of this, and we're very proud to host it. What I find that's wonderful is that we have scientists that want to share these results.
If you compare genetically Aedes aegypti, Aedes albopictus, they have 70 million years of difference.
If we reduce the lifespan of the mosquito to 1 week or to 8 days, the mosquito cannot transmit it.
I've touched many babies. I'm a mother. And we have to understand that all this has a meaning.
Those patients, it took only 4 days between the time they had their first symptoms in the limbs and the time they had to be rushed in intensive care units. So much shorter interval compared to what we usually see with Guillain-Barré syndrome.
We still don't know if the vaccine can protect, but can also elicit, for instance, Guillain-Barré.
We have time in the coming 3 years to do the proper studies to look at whether among all those Guillain-Barré syndrome and microcephaly cases that we currently see in those two continents, whether some of them could be attributable to Zika.
So what people tend to forget is that you want to be precise when you say someone is Zika, but you want to be just as precise in saying that someone has not Zika.
The mosquitoes that we release will bite people. So imagine if they're biting you. Better yet, imagine you had a 6-month-old baby or you had a very elderly parent. So we're asking a lot of the community.
We need to streamline the channels between the field and the lab and those people that are in charge of vector control.
We should have an international collaboration, an international collaborative effort to improve Zika virus diagnostics.
So that public health professional organizations like WHO and governments, ministries of health, can actually take decisions.
Train people, entomologists that know what they talk about when they talk about mosquitoes and emergence of virus.
We have to do science and medicine with our heart to have enough motivation.
That we are much quicker at reacting, and we're also much better at reacting together as a community.
We learn more about ourselves when we know that we have diseases together and we have to help each other.